As the UK crossed the grim milestone of 20,000 deaths in hospitals today, one of the highest in the world, a political row has erupted over the government's handling of the crisis. Centred around revelations in the Guardian newspaper that the Prime Minister's chief political advisor, Dominic Cummings, has taken the apparently unprecedented step of attending meetings of SAGE, the scientific group that advises the government. He was joined by another political appointee, Dr. Ben Warner.
That committee has to give independent advice, free from any political pressure to government. But the best way to clear this up is for the minutes of the committee just to be published so everyone can understand what advice the government is receiving, and then in turn understand the judgments the government is making based on that advice.
Downing Street said in a statement, Mr. Cummings and Dr. Warner have attended some SAGE meetings and listened to some meetings now. They are all virtual. But that SAGE provides independent scientific advice to the government. Political advisers have no role in this. As its record during the crisis comes under intense scrutiny, the government has said it relies on scientific advice from SAGE in efforts to tackle the virus, but still refuses to disclose its members' names. More pressure too today over the government's pledge to carry out 100,000 tests a day by the end of the month. For the second day running, coronavirus tests for key workers through the government's new booking website ran out. Less than an hour after opening, it was again impossible to either book a test at a regional drive-through site or request a home testing kit. Once new infections are down, the government is looking to roll out a wider track and trace program to help ease current lockdown measures. Other countries like South Korea and Singapore have used such programs to trace the movements of those infected, track down those they've been in contact with, and test them while they self-isolate. The government is now recruiting a network of thousands to help with its own program, while developing a smartphone app to map potential contacts.
I think it's going to be really difficult to run out a program because of the absence of the structures within the country. After 2010, government offices for the regions were abolished, strategic health authorities for the regions were abolished, and those are the sort of structures that had been used and have been used in the past when there were really, really major problems like BSE or like the fuel crisis. But all of that infrastructure has really evaporated.
Just one more challenge for a government trying to cope with a crisis like no other, and a death toll among the 5 highest anywhere in the world.
Now, on another weekend of warm sunshine, the public are being urged to keep observing social distancing restrictions and to stay at home to stop the virus from spreading. The Home Secretary, Priti Patel, underlined that message at the government's daily briefing today, acknowledging the huge sacrifices made. So how are people coping with putting their entire lives on hold? Our North of England correspondent Claire Fallon has been to Blackburn to find out.
The rules are the same. Stay at home is still the message. But on weekend 5 of the lockdown, the streets aren't also silent. In some places, there are more people and less space than the 2 metres we're meant to stay apart.
Because people are just getting bored now. It's very frustrating. Very. But there's nothing we can do, is there? We've just got to wait.
June lives by the canal in Blackburn. She took us to meet one of her neighbours.
It's hard work with him, though, because he knows everybody. He's like knocking at doors for everyone to come out.
How old are they all?
I've got, well, he's 1, and then I've got a 7-year-old and a 10-year-old.
At the moment, I envy people who have partners with them. Because I'm on my own talking to the dogs and the bird. My house has never been as clean.
In every home, on every street, people have their own frustrations and their own ways of trying to cope. People like Nick, who we met as he was walking Bonnie the dog on the canal towpath.
I've got a pregnant missus at home, so I'm trying everything I can to protect her, and obviously the bump, but yeah, it's tricky. It is tricky to try and avoid people and try and because obviously you can't see the virus, so he's one of them.
First child, or?
First child, yeah. So it's all scary. We don't know what's going to happen, obviously, with the birth.
Do you mind me stopping at a distance and just asking you how you're finding life at the moment?
In normal times on Saturdays, there's football and cricket in these fields. But not now, not for who knows how long. Calvin told me he's been coming early in the day to beat the rush.
I've noticed this week people have been more, I wouldn't say lax, but there's been more people about, and it isn't changing the weather, because the weather's been lovely for the past couple of weeks, hasn't it?
Why do you think that is?
People are getting bored, and they just think they can just do what they want. There were a group of bikers here yesterday on scooters. There must have been 25, 30 of them.
The newly painted writing on the grass is a message to the NHS and the carers and the key workers. It calls them local heroes. Proud of you, it says. But if places get busier, those words might feel out of step with people's actions.
Claire Fallon reporting, well, to ease the lockdown, we need a much better understanding of who's had COVID, especially if they weren't showing any symptoms, who might get it and how badly. Enter a major new study run by the Department of Health and the Office of National Statistics, involving at first 20,000 households. Well, joining me now is Sarah Walker, who is Chief Investigator for the study and Professor of Medical Statistics and Epidemiology at the University of Oxford. Thanks for coming on the programme, Sarah Walker. So, how important is this study to remove some of the many blindfolds that we still have on regarding the true nature of this disease?
So I think it's hard to underestimate the importance of this study at the moment. As you said, it's going to answer such critically important questions over the next month and actually through the year. So who really has the infection now, and how does that change as measures around lockdown change? Who gets it from week to week? Who might have had it in the past by measuring antibodies in the blood that fight infection? And answering a question as to whether you can get it again. We've got every reason to believe that you can't, but we don't know that for certain, particularly if you've only had a mild infection or if you've actually had an infection and not realised it at the time. And this study is designed to answer those questions.
So it's a little bit like an opinion poll, but with a swab.
It is, and this is, what's so brilliant about using the Office for National Statistics. So what they've done is they've selected 20,000 households for this first wave of the survey to really represent the population in the country. We've had a fantastic response. We're so grateful. But actually, that's why we, at this stage, only really need to hear from people who've had a letter from us, because that's how we'll make sure that our study really does represent the country. And more letters will be coming through the year. So just because you didn't get one this week doesn't mean you won't get one in coming months. Please look out for them.
OK, and when you get that letter, don't ignore it. It's important.
Please don't.
And you referred earlier to the fact that there's lots of things we don't know. It will be alarming for many to hear that we really don't know whether if you've had this disease, you're now actually immune from getting it again.
But it's a brand new virus. It only launched onto the world stage 4 months ago. What we do know is that we can measure antibodies that fight infection in the blood, and that after infection, these levels rise very quickly. So over the first 1 to 2 weeks, people will develop a very strong response. And as I said before, there's every reason to believe that you will have immunity, but we don't know that for sure, and we certainly don't know it for these mild infections or these infections without symptoms. And it's also important to understand that no test is 100% perfect, and we need to be very careful about immunity, about telling people that they could be immune when they might not be.
And these are two tests, aren't there? There's a swab test to see whether you've got it, and then there's the antibody test, which involves a blood sample to see whether you've got the antibodies for it.
Yeah, so the swab test just says, have you got it now? Whereas what the antibody test tries to do is tries to say, have you had it in the past because of these rising levels? We're asking everybody to have the swab test. And that's because actually after 4 weeks of lockdown, we're actually expecting the rates to be very low in the community. And to detect a low rate, you need a lot of people. We think many more people in the country will have had the infection, and so we don't need to ask as many people to give blood. We know this is a really big ask for people, particularly with everything that's going on at the moment. And we are asking everybody to have one visit, but if people feel they can manage it, we're actually asking them to have weekly visits over a month, or even to think about having monthly visits over a year.
Right.
And we don't want to ask more people to give blood than we need.
And the difference here is that you're hope to be doing repeated testing of the same sample group rather than just using the government's information of the tests they're already conducting.
Yeah, exactly. So we'll be following people over time if they're happy for that. And we'll also be recruiting new groups of people every month, we hope.
And just very briefly, unless we really find out, the nature of this disease, the chance of a return to normality, an end of the lockdown, is impossible.
Well, what this study will tell us is how the different lockdown measures are really working, and it should enable us to work out the best way to manage this pandemic over the next months and year.
And that's crucial. Professor Walker, thank you very much indeed for joining us. Now, the government has launched a campaign encouraging people who need urgent medical care not to avoid seeking help, warning that delays in getting treatment could put long-term health at risk. As figures show, the numbers going to A&E departments has dropped by half. The head of NHS England said that vital services were still available for serious non-coronavirus conditions like heart attacks and strokes. Here's Minnie Stevenson.
While treating COVID-19 is dominating hospital wards, many A&Es are comparatively deserted. Today, NHS England urged people to seek help in a medical emergency after growing concerns that those having heart attacks and strokes simply aren't calling 999 during the pandemic because they're worried about being a burden.
We don't understand why there's been such a dramatic reduction in stroke presentations at hospital. And our message is clear. You must act fast. Call 999. It could be a medical emergency.
The concerns came after NHS England found that the number of patients attending A&Es had fallen by around 50%.
Well, the government say it's absolutely critical that people come to A&E and use the NHS for medical emergencies. But at the same time, there are thousands of people across the UK who have had their urgent operations cancelled due to COVID-19. Today, senior NHS bosses were accused of handing out mixed messages.
While the Health Secretary Matt Hancock stressed that those at risk of cancer and other medical emergencies must use the NHS. Chris Romney finds he's not only frustrated, but he told me frightened. The grandfather and father to 4 has advanced prostate cancer. His urgent operation was cancelled when the ward he was supposed to be treated on was turned into a COVID response unit.
This is a national disgrace that so many cancer patients are being sidelined and their lives put at risk, and you could well end up with more of those people dying unnecessarily than are going to die of COVID-19.
With no new date for his operation on the horizon, Chris and his family are left not knowing what next.
I'm worried, but I'm also very angry. I'm increasingly angry, which is why I think it's really important that people do stand up and try and hold these people to account and tell them to stop making out that it's business as usual in the NHS when it's absolutely not. And people are dying as a result of decisions which are being taken.
The government say the NHS is open to those with serious illnesses and processes are in place to keep people safe. But there are serious concerns that tens of thousands of other non-COVID patients will die in this pandemic because of a lack of treatment or diagnosis, when ordinarily they would have survived.